Good morning, everyone. This is Sandy Marrero with Western Marketing. I hope that everyone is having a fantastic OEP or AEP, depending on which way you want to do it, on the AC8 or Medicare Advantage side. Today, we are going to talk about group health, specifically the level of self-funded plans and some other areas. We have with us Craig Midlands, the director of the National Marketing Director for Exemplar, and we're going to be talking about how are they doing to change the game in fixing the American health system. Craig, without further ado, go ahead.
All right, perfect, Sandy. Thank you so much. Again, my name is Craig Midland. I'm the National Market Director for Exemplar. But just a really quick background on myself, kind of how I got here. I really started where most of you are, being in the insurance field as a broker, and did that and lived my whole life in Wisconsin up until a few months ago, where I moved here to High Point, North Carolina, which is where Exemplar Insurance Associates is located. How I got here, like most people in insurance, went to college at UW-Madison, kind of fell into an insurance group as I was graduating, and have stayed in insurance my whole life. And so 30 years of experience here with that. And the majority of it has been in the healthcare as a health broker. As many of you know, we kind of are limited as far as the options. The ACA, originally there were some things that I thought were great about it when it was first coming out, but again, you can obviously see the industry changing. And so I kind of stepped away from the health side for a little bit, and then got back into it a few years ago. And so much like many of you, I was very new to the level funded space, which is what I'll spend the majority of the time today talking about. And I was just used to selling the traditional fully funded health plans, but I got frustrated because every year I would get my rate increases, and I would go out and I would compare rate increases and say, here you go, here's the lowest rate based on what we have, even though they're all going up. But I really had no solutions, and I really just kind of felt like I wasn't really offering a product that was helping the employees. Call it me getting old. That I really wanted to provide value versus just kind of giving an offering of a few different dollar amounts on a sheet, and then seeing them a couple times a year. I started working with Level Funded. I got to know that a little bit. Really liked some of the pieces of how that product worked, but I became frustrated with the actual carriers that I was working with. Again, because it seemed like there were a lot of different pieces to the pie that were being used, and a lot of times I was finding there was a disconnect when I was trying to work with the groups. And then, of course, the kind of the goals of the plans weren't necessarily aligned with what I was looking for. I was introduced to Tim Hawley, who was on the book here that we're looking at. Probably about a year and a half ago, I guess almost going on 2 years now, and really liked what this particular company was doing internally, what they were trying to do, and how they were trying to change how groups and individuals use and pay for their insurance. And so I started working with them, started introducing this product to some other brokers that were not kind of in my region, as it were. And we had a banner year last year. With that, they invited me to join them here at the home office. And so I moved here in July from Wisconsin after having been there for all those years. So what I love about this company, Exemplar Insurance Associates, is that they are really focused on the end game and the end user. And to me, that was very, very important. So it's not a matter of just selling an insurance product. I really changed my mindset to what am I doing to help these groups? How am I solving for that? How do I have an individual in a group who has an expensive medication? How do I help that group keep their insurance next year versus just having that huge rate increase? And so those are the things that they're doing internally here. And you'll see Tim on a few of these slides. I'm not promoting his book, but obviously it is here, and if you're not familiar with level funded, but you are looking for kind of some tidbits that go into a little more detail on some of the things I'm covering today, this is a really nice book to read. It's available on Amazon. Tim Hawley wrote one of the chapters, so there's different views from different people that are coming from different angles on it, but it really helps kind of give an understanding of where we're coming from and why. There we go. Come on. Ooh, there we go. All right. Sorry, I went right through. All right. So Exemplar, who is Exemplar? Because I guarantee that 90% of you, unless I taught you directly, have never heard of Exemplar before. I hadn't. What is Exemplar and how do they work? So Exemplar is actually comprised of 22 individual companies. They're all headquartered here out of High Point, North Carolina. Total, we're actually probably closer to 300 employees now. This is a little bit old. Some of the companies that we own, we have our own insurance brokerage. We do actually own a company, Presidential Life Insurance Company, and I'll talk a little bit later about why we have that. We have our own wholesale drug distribution company. So if you ever come to our offices, we don't look like a traditional insurance building. We own independent pharmacies, medical services organizations, doctor's office. The other big pieces for a level funded plan that I'll get into a little bit here that are important are the pharmacy benefit management company. If you're not familiar, if you open a pharmacy, you can't buy drugs directly from the manufacturers. You have to go through somebody and one of these type of PBMs that they're called. The great thing about our product here at Exemplar is that we own our own PBM. We also own our own third-party administrator. Think of the third-party administrator on a level funded plan as the group that collects the money and pays the claims. And I'll get into a little bit more detail here. But this is a very, very, very important part of this puzzle when it comes to a level funded carrier. If you're not getting claims paid on time, if you're not identifying things within the claim, that is where you're going to see a disconnect from the end user and where you see a lot of problems that come up. And also issues where you have large rate increases if certain elements to a group aren't being identified. And we'll talk to you a little bit more about that. And then of course, pharmacy and physician networks, okay? I'll talk to you a little bit more about that as well. One thing that I do mention here, that while we do have a brokerage and we do have access to these companies, the reason that Exemplar even exists is because we became frustrated, as I kind of mentioned, as I did personally, with the options that were out there. We felt like the people who has the money are making the rules. And the problem that I felt with these particular carriers is that it was less about taking care of the employee on the back end and more about the business as it is. All about profits, right? Most of these companies publicly traded who are then trying to make the most money for the shareholders. And so I just really felt like there was a disconnect between what they're doing and how they're doing it. The other thing is obviously a lot of the laws and things that are being passed. They have the large lobbying groups that are in Washington. In fact, a lot of these groups are actually anti-level funded. There's actually a rumor that they're trying to get Congress to pass things on that. Don't think it'll happen, it'll be a long time, but those are the types of things that they're doing because they don't like their market share being taken away, I guess, is the way it was explained. When we say BUCA, if you ever hear me say that, that's the Blue Cross, United, Cigna, Aetna, Humana. I know that Humana has recently moved out of a lot of the markets on the health side as well. So when it comes to insurance, how does Exemplar win? What is different about us versus those other carriers and what we do? For those of you who aren't familiar with level funded insurance versus a fully funded plan, I first want to talk a little bit about some of the underwriting pieces to it. So the biggest difference between a Blue Cross fully funded plan and any level funded insurance plan, whether it's ours or another carrier's, is that the fully funded plan is what's called community rated. So you have your community, you have people in that community that are not necessarily taking care of themselves, or there's a particular pocket of area where there's higher cancer individuals numbers and stuff. And so you have a disproportionate amount of higher premiums to cover the sick, which then gets spread out to everybody. Okay. And there was a growing frustration of why are we paying this for everybody else when our group is being super proactive and working really hard to save money and to be healthy. And so that's the community rated plan. Okay. Level funded, however, is group rated. So we are actually going to go through some underwriting, and I'll tell you a little bit about how we do that and some of the differences with ours versus some of the other level funded on the market as well. But what we're able to do is actually look at the particular groups as a whole. Okay. Now with that, if you have a young group, lots of single individuals that are in their 20s, 30s, obviously those rates are going to be much better than if you had a group where everybody was over 60 and married and or had kids. However, even with those groups, we're seeing where our rates are very, very competitive versus those fully funded plans. So how does Exemplar kind of separate itself from some of the other level funded? And I'm going to show you this slide, then I'm going to get into kind of what makes up an actual level funded plan. But the biggest difference with Exemplar is by owning the other pieces. And what I'm talking about there is the TPA. We are involved with the stop loss, the pharmacy benefit management company. Because we own those, and if you kind of think about it, think about a level funded insurance plan as a puzzle, and you have different pieces. So if you own the majority of the pieces, you can decide what your margins are within those pieces. Whereas if you're just putting a bunch of different pieces together, every separate company has to make money. That's why they're in business. Okay. We also are not for profit. Okay. However, if we own 4 of the 5 pieces here, we don't have to actually make money on all 4 of those 5 pieces. We just have to make money on one and cover payroll on the others. And so that's really part of the difference in what separates us. It's the biggest thing that separates us from the other level funded carriers that are out there. And then from a service side, I'll tell you personally, part of the reason I'm standing in this office today is that I had some other groups with some other carriers, and I had a heck of a time when there was a problem with the claim. I'll tell you, I was reaching out to my contact. That contact was sending an email to the TPA, which was located someplace else in the country. And I was waiting 3, 4, or 5 days to get answers back because everybody had a 24-hour thing on their email. Well, because they had to go through 3 parties, next thing you know, I'm waiting a week to get an answer on a claim for somebody that's worried about it, one of those end users. Where my office is here, I can physically see people from the TPA getting up and walking over to member services and working with them to get claims handled. So they're across the hall. And I know it sounds kind of old school, but from a service standpoint, it actually really does separate us from a lot of the other level funded carriers. Real quickly, I just want to kind of cover for people that don't know kind of really what a level funded plan is. Okay. Fully insured, we already kind of talked about, and hopefully most of you are familiar with that. But basically, you're paying the company. The company makes a promise to pay for any claims after you've hit your deductible and copayment. They have rates set that are community rate set. So whatever your rates are for that community, that's what they are. So every group is the same, super easy to quote, right? It's agent friendly from that standpoint. However, at the end of the year, that company does not have an incentive to be healthy. It doesn't really matter if they're using the insurance or not in a way, because they're going to have the rate increase based on the community factors. And again, they're not going to have any money back to the company. Okay. A level funded plan is split up really into 4 boxes. The first box here we have is administrative expenses. So those are some of the things that we just talked about. Your TPA, right? There's a cost in every level funded plan that goes to the TPA. Okay, so we have that set. Obviously, member services individuals have to get paid. You as an agent need your commission, right? So you need to get paid. Okay, so those are all numbers that are in the administrative expenses, and those numbers are always set, right, at a set amount. The next block you're going to have what's called stop loss premiums. So what a level funded plan is almost like taking a deductible and putting it on steroids. And so what happens is you have this much larger connecting point before an actual insurance company, quote unquote, like Liberty Mutual, Standard Life, Gerber. These are all stop loss carriers that will actually kick in and start paying the claims. And so you have this bucket of money that's going to go in the actual claims. So that's kind of the next bucket, that orange one there, where you have your actual claims fund. And then you have a charge that goes to the stop loss. That's just like paying an insurance, like you're thinking about with your traditional insurance plans or your auto insurance, home insurance, those types of things. So they're going to cover if somebody has a $2 million claim, okay? And then you have those actual claims funds. And then that next bucket that's kind of outlined there, that's your potential savings. And so these top two buckets really are tied together. On a level funded plan, the employer can actually get back under our plan either a 0% back. So they're actually going to take the cheapest rates that we have available, but they wouldn't actually get any money back at the end of the year if there was money left in that claims fund bucket. Or they have a 50% option where they can get 50% of those savings back, or 100% of what's left of that after what's called a run out period. Ours at Exemplar here is a 12/18. What that means is if your policy runs from January 1st to December 31st, you would actually be looking at July 1st would be when your dollars would be available back to the company. And that's just simply because we have to make sure that we get all the claims before we hand what's left in that claims fund bucket back to the employer. Okay, so that's just kind of a quick overview of what level of fund it is. I don't know if Sandy can talk here. He was maybe the only one I may be able to hear. But traditionally what I do with a group like this is I ask a question, and it's simply, what is your dream car or truck? Sandy, are you on there?
I am here. My dream car is an SUV. I like SUVs. So
Very
Lincoln
nice.
Navigator.
All right, so a nice one. Would you drive that Lincoln Navigator off the lot if you didn't know what the price was?
No, I wouldn't.
You wouldn't. So
Oh,
why would you go in for a hip surgery if you don't know what the price is?
because that's the
So
way that we have been set up for years. That we go and then it's whatever we pay, whatever they told us to pay on the health side.
exactly. And that is our complaint with the system, and how we are frustrated with the BUCAs, because the American consumer has been led to believe that health insurance is different than every other product that we buy. In that we don't know what the cost is. We don't know that there are other options within our area that we could possibly go to. We're not allowed to shop around. Doctor ratings, which there are doctor ratings for how good doctors are. We are not allowed to see those because they are in the PPO contract that says that they don't have to provide that. And so those are some of the frustrations that we have with the insurance industry. And this is really, big picture, when we're looking to work with people and we're teaming up with agents like everybody on the call here today, this is how we're separating ourselves from those other agents that are out there, is that we are working with our groups, teaching them this. And I've yet to walk into a group where that light bulb isn't instantly on with that and with them agreeing. Like, nobody ever wants to debate me that they should be allowed to see how much surgeries are going to be prior and to see if their doctors are ranked well or not. So one of the biggest things, again, when we're talking with an employer on some of the things that we're talking here, is that they are masters of supply chain management in everything in their business except health insurance. And that is what our job is to help that business owner understand the supply chain management of health insurance. Okay, they need to understand pricing. They need to understand some of the vertically integrated partnerships on a level funded plan, like we talked about. Procurement, where do you go to have a surgery? Traditionally, I go in for something and I see my doctor at a hospital and they're going to tell me to have my MRI done there at the hospital. Well, guess what? There's a facility a block away that I can do that same MRI that I'm getting charged, $2,000, sometimes $3,000 for through the quote unquote hospital group. I can have the same machine done a block away for $300 or $400. Okay, it's ridiculous. Blue Cross doesn't care about that because that's just going to increase the spend. Now they can justify a rate increase saying, look, we spent more money. One of my other complaints, and originally when the ACA came out, for those of us who've been around long enough, I thought that a 15% profit limitation, which is part of the ACA, that the Blue Crosses and other BUCAs of the world can only make 15% profit. I thought that was a great thing, but it wasn't because what it really did was create a scenario where there's no incentive for them to give you lower rates because that actually cuts into the profit margin. If you're paying $1 million for your group's health insurance this year and they raise your rate by 10%, they just went from making 15% of $1 million to 15% of 1.1 million. Okay. So it's kind of one of my, again, complaints with the way that the system has been set up with that. So again, these are all things that we're trying to educate the employers on, educate the employees on. Some of the other things that I want to talk about now are a little bit of, we tried to cover kind of what level funded is and why we feel like level funded is better than fully insured. Now I want to kind of turn the page a little bit and talk about what separates Exemplar from some of the other level funded options that are out there. And there are new options every day. I get hit with emails every day from new level funded companies that are out there. The majority of them are backed by private equity. I feel like if I'm getting out of the frying pan of the BUCA groups where they're all about profit, why would I jump into the fire with a level funded solution that is private equity? Because private equity is great if I want to invest in something and make a bunch of money, but if people invest in it, they expect to make a bunch of money. So all of a sudden you're right back into the same problem where maybe you have some of these solutions involved in your actual plan, but big picture, what they're ultimately doing is trying to maximize profits. So Exemplar, again, kind of back to some of what separates us from the other level funded carriers, is we're really focused in our history, and from that first page that I talked about, if you notice, a lot of those companies are pharmacy based. So the president of our company, he is a PharmD, also has his master's in business, etc. One of those guys that did way better in school than I did. But anyway, he really comes at the health insurance from the pharmacy side. So he saw the problems, he saw the rebating that was going on, he saw the kickbacks to the large carriers that were going on, and he just became very frustrated with that. And so he got in on the pharmacy side from the PBM and the wholesale drug, trying to help these kind of small town pharmacies who are getting beat out by these large conglomerate pharmacies from a pricing standpoint, because it was really kind of becoming a monopoly in a way on some of this. And so that was kind of where he started. And now we're in a position, though, because we own that PBM, where we can now have direct access to those medications. So if you have an employee that is on a specialty medication, we can actually help protect that claims fund bucket that we talked about, that kind of first chunk of money there, by saving them, by being able to go direct, working with patient assistance programs, as well as doing mail order pharmacy to those employees. So, and again, because we own the TPA, we actually are able to flag employees who are using particular medications where we know we can save them money, and then we're able to reach out to them. The importance of that is kind of twofold. First of all, we're protecting the employee who needs the medication. We want to get them that medication at the lowest price possible. But second of all, the large problem with a lot of these level funded carriers is that they have a great rate the first year, and then the next year they have a big rate increase because somebody took a bunch of meds. What we're finding though with specialty meds, I mean, I'm getting a little off topic here, but is that everybody's talking about that. All of the webinars and all the materials that are coming out, and all the other level funded carriers are like, hey, we work with these specialty meds. But when it comes down to it, primarily what they're doing is working with them and get them on physician assistant programs, or pharmacy assistant programs rather, PAP things. And what that does is actually helps get those employees that drug for free based on incomes. The reality is though, that 90% of the drug spend is not actually within these groups that are having these high rate increases, is not that one large medication. It's actually medications that are running between kind of 1,000 and 10,000 a year. So again, because we own the TPI, we're actually able to flag claims that are coming through at certain dollar amounts. And then again, we're able to see what medications they're on and able to work with them first to see if there's another medication that maybe is the same as that medication that they got from the doctor. Of course, the doctor is probably going to promote a name brand drug, but is there another medication that's cheaper that does the same thing for that person? But secondly, if they do need that particular medication, how can we get that to them the cheapest? Okay, and so that's again something that we're doing internally that's really separating ourselves from some of the other level funded carriers. There we go. The other thing that we talk a little bit about is we have actually partnered with a company, and we really promote direct primary care. We have a company that it's basically telehealth on steroids, and we'll send you out information on the quotes. So as we get into the quoting process, I'll kind of tell you about how to let us know if you want this included in the quote or not. But what we're really seeing is we have a higher number of groups that are renewing, and we are over 90% on renewals year to date, which is important to note. But the ones that we're seeing even decreases on are using a direct primary care. The great thing about the direct primary care, again, is it's protecting that claims fund bucket. That first chunk of money that employer is putting in there, that's being saved to help cover claims. And what we want to make sure is that there's as much money left in that bucket as possible at the end of the year. Because if we never have to use that stop loss carrier, the Gerber's and Standard Life's of the world, then we're not going to see increases on the plans. So all of these, where they have the preventative, they're going to do the zero cost to the plan, co-pays as far as doctor visits, primary. And what they've done is really taken that primary care model that you go and you see one doctor, and they're doing that virtually. Okay. So instead of a telehealth where you're calling and getting a doctor every time, you're able to actually have the same individuals that you're talking to. So there's a little bit of a get to know them from that standpoint. The other thing, depending on where you're located geographically, is that once they get to a certain number within a community, they'll actually set up a freestanding clinic, which is huge. We've got a couple over in Western Wisconsin now, and we've had a lot of success with those. Network options. I know Sandy asked about this. So we currently work with MedCost, Alliance Trilogy, Health Savers, which is a great one depending on where you're at regionally. So we've got HealthLink, PHCS, First Health, Cigna, and so and some other regional ones that I didn't even list there. When you send a census in to us, what we're going to look at is where the employees are located. And then we're going to match that to match the best network for those employees. So if you send us a group that's based out of Green Bay, Wisconsin, but they also have another bunch of employees in Toledo, Ohio, we're able to actually look at that and pick the best network for that particular group. Okay. We do have, obviously, like First Health is a huge network. For those people who aren't familiar, even the large carriers of the world, the BUCAs, they rent networks. Okay. So these networks are a lot of the same networks that are being rented by the other fully funded carriers. Most people don't realize that portion of it. So lots of different options for you. The other thing, because we own a TPA, if you live in an area where there's a particular kind of regional medical facility network and they don't want to work with some of these other networks that I listed on here, so they're not part of those, we will actually direct contract with them as long as they'll play ball with us. So we'll reach out to them, we'll say, hey, here's what we'll pay you for these things. And if they say, yeah, we'll agree on that, because again, they're going to get their money very quickly from us. So we do see a lot of networks that will sign up with us. But we'll actually do a direct contract with them as well to get those facilities into your network, so that makes your selling easier. So don't be afraid to reach out to me on that stuff. So when I go out to business or I'm working with agents who maybe aren't familiar with going out and selling group health insurance, this is the question that I always tell them to ask the business owner. If we could put money back on your balance sheet next year, what would you do with that? And then here's my little sales thing of the day. You have to say nothing. He who speaks first loses in this particular question. So you just have to wait for that employer to respond, okay? Most of them are going to start talking about doing things that are going to help the employees, help the business, purchase something to make business, something that's going to help them make more money. And then when they're going to ask about that, you're going to tell them those dollars that you're looking for to do that, those dollars are already available to you. They're hidden in your current health insurance plan. And then you're going to ask why, right? And then you're going to jump in and talk about some of the things that we talked about today. Okay. And we'll be able to send the presentation out to you guys as well, so that you have some stuff to read. And then I'll be available to you guys more of an individual basis as well. Sandy's going to send out some follow-up information to you guys that has my contact information. So if you have some specific questions and or want to do some additional training on this as well. But again, at the end of the day, it's all about the money. Just kind of a reminder why to use Exemplar when you're out there. A couple of things as far as the underwriting that I want to talk about. So our particular plans, we actually have 2 stop-loss carriers that we use. Remember, we talked about that kind of the end-all insurance. So if you have a huge claim, would it kick in? And those stop-losses have different rules for underwriting. So our first stop-loss, Standard Life, we can write down to 5 employees in 47 states. Okay, the states we are not in is the state of Washington, New York, and Hawaii. And so, however, with that particular underwriter, we will get a census from you guys, and we'll send out a copy of the census. But what the census information we need is going to be the full name, birth date, zip code, and gender for everybody that's going to be covered. So that is going to include spouses and children. Okay, so a little different than when you're doing anything for a fully insured. Once we get that information, we're actually going to run that through our quoting tool, and then we'll know if we're going to need any applications for anybody out of that group. Okay, depending on ages of the group, that's kind of where you see some differences. But we see a lot of groups that come through with 10 employees. They may need 1 or 2 applications. A lot of times, those are things that have popped up through that underwriting process. And we have over 1,800 touch points that we're doing through this electronic process that we're doing with here. It's kind of creepy if you think about all the information they know. But anyway, What it's going to do is flag things for people that have had usage and, of course, medication usage, those types of things. I never look at an application as a bad thing. When I'm talking to an employer, I always say, if we need applications, traditionally that actually helps with rates, because the more information we know, the better job we can do. A lot of times somebody had something last year and they're now done, and that's not going to be an issue moving forward. So if we can get that information, that's going to help. If you do run into a group though, or you know of a group that is just, they don't want to do applications. This is new, right? They never had to do applications for fully insured. Well, depending on their age, if they remember 15 years ago, they had to do applications every year for everybody. But for those who kind of have forgotten about that and have gotten used to the fully funded insurance quoting tools, we do have an option through Gerber Life. Everybody's heard of them. And they actually are not requiring applications for us, okay? Now, they do have a couple other rules within there. One of those is that you do need 50% participation out of the eligible employees after waivers. So what that means, if you have 10 employees and 2 of them have insurance to their spouse, you only count 8. You'd only need participation out of 4 for that particular case. That the Gerber will go down to 2 employees, but it is state specific. There are some states that they start at 25. Florida is one of them. And I will be sending out a sheet included in some of the information you're receiving, so you know which states go down to what number on that as well. So those are kind of the 2 options. We have 16 standard plan designs on our royalty series. Those are designed to mirror most of the deductible copayment, drug copay options that most of the BUCAs have. So you can do a nice side-by-side on there. And then I do want to mention, we do have a reference-based plan for the individuals that are used to that. We do feel like, because of some of our proactive strategies that we're doing, that we already talked about on the level funded side, that we do reference-based pricing better. However, 90% of our groups are traditional level funded. So if you don't know what reference-based pricing is, I wouldn't worry about it for 2 seconds today. Maybe at some point we'll do an additional meeting on that. The other big thing I want to remind everybody, especially if you're newer on the group side, is that while we're in Q4 here, and there are a large percentage of individuals and groups that are going to be quoting their insurance for December and January, and they're really looking at that right now, that's really only probably 60% of the business. And so, we are seeing a lot of groups, first of all, that don't have a 12/1 or 1/1 renewal, but second of all, they actually, you can renew off cycle with our level funded plan. So if you go down the street and you go to A and B, car sales place, and they've got 15 employees and they currently have one of the BUCA plans on a fully funded plan, they can move that insurance at any time. They don't have to wait for a renewal. It's another one of those brainwash tactics where groups have kind of been brainwashed to think I can only change my insurance, one time a year. It's just not true for those that are on a fully funded plan. And we see a ton of new groups that come in even after the first of the year. So if you feel like you're missing out on some of these groups that are renewing right now, and maybe you don't have the contact at that group, go in and ask them a question in January. Say, were you happy with how you ended up with your health insurance plan after you did your renewal? I think you're going to see a high percentage of them that are going to say no, that they're not happy with that. Say, well, what if I could show you another option? You're not stuck in what you have for a full year. And I think you'll do very, very well if you just walk around and knock on doors and just ask those questions for you. Commissions, we talk about that real quick, okay? Our base plans, so what we do is we pay a $30 per employee per month for commission on that. And then, of course, you've got, with the different GA and stuff, you'll be able to get that. But the big thing to remember is that it's based on a per employee per month, and that is on a primary, okay? And if you do have a group that you're saving a lot of dollars, that dollar amount can be moved. That is something that the agent and you here at Western Marketing would have some say on. So, if you're saving a group a ton of money and you need to move that dollar amount, that's up to you guys really. So, as far as the speed and ease of underwriting, we are currently running between 5 and 7 business days from when we get a completed census with all the information that we need on it to having that quote back to the agents. So I just want to make sure, and a lot of that obviously is just because of volume on the fourth quarter right now. Traditionally, we run 2 to 3 days. But we want to make sure to set a safe expectation for everybody so we don't get things coming in and you've got a meeting tomorrow, that kind of stuff. So once in a while we can get things rushed through. We understand that things come up, but just want to make sure that we've kind of set the expectation. Last but not least too, I wanted to talk real quick. I talked a little bit about the participation requirement for Gerber, which is at 50%. And then with Gerber, they do actually require an employer contribution. With our first stop loss, Standard Life, they actually do not have participation requirements. So if you have a group and they may need an application or two, but we can write that group. If they have 12 employees and only 5 of them take it, we have a solution for that for you guys. Okay. It's part of what we're doing again to try to separate ourselves to have different avenues and different options for you guys. So, and then the same thing with the contribution requirements. With Standard Life, we do not have the employer contribution requirements like the other carrier that we have. So most groups, you see a much better enrollment if the employer is participating though. So I'll kind of say that from the sales side. So, all right, I will open it up to questions here.
Great. Let's see if we have. Let me actually see if I can open some of the guys' questions. Or what I would do to make it easier and simpler, I'll go ahead and ask some of the questions that have been asked from the beginning, and then if someone else has any questions, they can raise their hands. I can unmute it, or they can just send me a question on the questions chat. Okay. The first question that I have is, of course, this product was available in Oregon, and the answer is yes, it is available in Oregon. What group sizes do you work with on this plan?
So, well, we have 2 options. We have the one option that is state specific, but in a lot of states it goes down to 2. And again, I'll send out the sheet that has the state limits on that. I don't have them all memorized, but we always have our first option, which in all 47 states would go down to 5.
Okay, and what is the maximum?
There is no maximum.
There's no maximum.
Yeah.
All right, so you can have a group of 1,000 or less, right?
Yeah, that would be great. I mean, traditionally they do a full self-funded, but no, we absolutely would love to see that.
Of course. And then is there deductibles and out-of-pocket maximum carry over from fully insured plans?
Yes, we can do a credit, which might be what the question they're asking is. When I was talking about doing a off-cycle start, we will do a deductible credit. We will not do a maximum out-of-pocket credit, which is pretty standard.
Okay, and then since this is major medical group site, it does follow the ERISA's guidelines as state mandates. Is that correct?
Actually, that's not with the particular way we are set up and domiciled. That's why we're able to go down to 5 through the one stop loss carrier that we have. So we have one stop loss where we can go down to 5 in all of those 47 states, but we may need some applications. And then we have option.
Okay, so,
yep.
But it does follow the ERISA's guidelines, right?
Well, no, because like Florida is 25. Okay. Well, we actually can write down to 5 in Florida.
Okay.
Yeah.
All right. in that case, those are the questions I have right now. And let me see if there's anybody else. The other question was a reference base.
Mhm.
Is this a reference base plan, or what networks do you use? Typically, you have a different PPO options for that.
Yeah, yeah, 90 overnight, well, actually probably closer to 95% of our business is not reference-based pricing. This is going to, so we have with the three options as far as the dividend, or we want to call it 0, 50, and 100% being returned to the employer. If you have a group that's fully funded now and they're uncomfortable about level funded insurance because again, there's a lot of media out there that's kind of trying to sway people away from it. My guess is I know who's leaking that, but anyway, if they have some misunderstandings on that level funded plan, if they were to use our 0% option where the company would not actually get any money back at the end of the year, that plan to the employer and the employee is going to look, feel, taste, act, walk, talk, just like a fully funded plan. However, we're going to have better rates. And then we are also still going to do all those proactive things that we're talking about to protect that claims fund bucket. So it's not just a one-year solution. It's trying to keep that group on the books for a long time. So you're not having turnover every year, because that takes time too.
And finally, how competitive do you guys think you are against other self-funded, level-funded plans such as Aetna, Allstate, and others?
We have been very, very competitive in most areas. Every once in a while, we'll run into a pocket. The reality of it is too, having done this for 30 years, whether it's fully funded or level funded, there are going to be periods of time where companies are going to kind of, what we call in air quotes, is kind of buying business, right? Because they feel like if they can get them in-house, even if they're not necessarily a great fit for level funded based on underwriting the first year, now that they're in-house, they can possibly switch them back to a fully funded next year if their claims things doesn't work out. So, we're very, very price competitive. One big thing with us that I always am telling people is that we really want to work with the agents looking at the big picture with these groups, meaning that it's not always who's a nickel cheaper. What are we doing to protect that claims fund bucket so that next year you're not having the same conversation of saying, okay, well, great, we've got an 18% increase. Now what are we going to do? Right? And so we really focus on some of this education with the brokers that we're working on. So it's not always, and I understand you have to be close numbers, right? Nobody's going to pay 50% more. But if we're close, we're very confident in what our renewal numbers are going to be long term.
All right. That said, I think we are going to close it for now on the questions. If you guys have any more questions, feel free to send those email in to us, and we'll be more than happy to assist you with any other questions. I will be sending you a copy of this webinar so you have access to it, and then a sample of all the products. I know that you guys wanted to see how those products look like, so we'll send you a couple of those brochures. I want to thank you very much for participating and taking the time out of your busy AEP live to sit down with us and work on that. So thank you very much, Craig, and make it a great day, everyone. Have a blessed one.
You bet. Thank you, everyone, for joining, and we'll make sure that you have the follow-up information as well as my contact information so we can talk more. Look forward to meeting everybody.
Thank you.
Thanks, Andy.
Thank you. Have a good one.